Oh, yay! Is anyone else there?
Here we go.
Yay! We got technology working.
Yay!
Sorry about that, guys. We definitely just practiced for like an hour and a half.
No, this is on the fly. We actually did not practice anything.
No, didn't even do my hair today.
Okay, I think we're good. Dr. Shiner, can you hear us?
Yes.
Okay, welcome everybody. My name is Julia. I'm Dr. Shiner's nurse practitioner.
I'm Alejandra. I'm Dr. Shiner's licensed medical esthetician.
And
we are here just to give you guys a little skin one-on-one while everybody's cooped up at home, or if you're not, it's great. We wanted to also say that, we're obviously not in the office right now, but anything you guys need as far as guidance for your skincare, any virtual consultations, anything you want, we're going to share information at the end, and you guys please feel free to contact us. I know it's a weird time right now, but we are all in this together, and we are here for you guys as if we were in the office working.
yes. And we just wanted to get on here today and spend some time with you to make sure that you have everything you need to make sure your skin is staying healthy and just kind of maintain some peace of mind throughout this uncertain time. And thank you to all the first responders, doctors, nurses, all the essential workers that are out there right now working hard for us.
Yeah, our delivery services. Thank you. I couldn't survive.
So we are going to be doing a giveaway at the end of this live webinar. We're going to select a viewer to win our Definage Anti-Aging Travel Kit. And Definage is our newest top-of-the-line product that we carry right now. The results take about 3 to 6 weeks. Use it twice a day, and you should see a global improvement in your overall skin complexion, fine lines, wrinkles, hyperpigmentation, and reduction in pores. So the travel kit comes with a 2-minute reveal mask, barrier repair cream, and bioserum. So stay tuned for that.
It's amazing.
So many of us are social distancing, so that has us ditching our normal routine. So it can be kind of tempting, even for myself, to get a little lazy here and there, but you really want to be consistent. Consistency is key when it comes to your normal skincare regimen, morning and night, to keep your skin on track.
Yeah, so as we are spending more time inside, I've found a few people, and like Julia said, even myself, you tend to think, all right, well, I'm not going outside. I'm not being exposed to free radicals. I don't have to wear my normal stuff that I wear. But the truth is that you do, because this whole time that you have been spending on building that regimen, if you start skipping days and getting lazy, then you're just going to backtrack everything that you have worked for. Not to mention, being cooped up inside, I started feeling a little dry and patchy because the air conditioning that we're just sitting in, it's not good for your skin. So go outside, take a walk, get the little bit of vitamin D that we need just to get your skin feeling. I mean, it's not only just good for the soul, it's good for your skin too. So get that vitamin D.
And, when you stray from your products, you'll notice your skin's going to be dull, dehydrated. Your complexion is just going to be more congested, which means greater chance for breakouts. So I really, really like a glycolic acid wash a few times a week. Really does the skin well. And what do you think about that as far as cleansing?
Yeah, I mean, cleansing is obviously, even if you're not going outside or working out, the first thing in the morning, like you're brushing your teeth, you should wash your face. And before you go to bed, you should wash your face. Like, even though we're not being overly active outdoors or whatnot, our skin is still working. You're still getting your dead cells that need to come off your face. If not, you're going to get what you just said, Julia, that dull looking, that we don't want that. We want the glow. We still want to look good indoors.
Always got that glow.
Yeah.
And then we can also incorporate antioxidants, which is really important. So after you cleanse, you want to put your serums on, your vitamin C serums, your growth factors, your retin A at nighttime to keep the skin kind of exfoliated.
Yeah, you want to go through your whole routine. Now that Julia mentioned exfoliation, there is such thing as over exfoliating. So make sure that you're not overdoing that, but always have something that's also treating your skin. So yeah, you're going to wash your skin, you're going to treat your skin, wear a moisturizer, and most importantly, don't skip your SPF. People think because you're not going outdoors that you shouldn't wear SPF. If
And
your
we will
house has
know. We
windows,
will know if you're not wearing it.
yes. If you have windows in your home, you need SPF. So yeah, don't skip it. And I know Julia has a few that she really loves, even for whenever
Yes.
she works outdoors a lot. So
Since all of the gyms are closed right now, and so I've been exercising outside more often, and so you don't want to neglect your skin. You want to protect it. When people ask me if I had to just buy one product, what would it be? I always say sunscreen
SPF,
moisturizer,
yep.
and use it every morning. Put it right by your toothbrush. It's the best way to treat aging skin, is to inhibit the major cause of aging, which is the sun. So
So you're preventing, yeah.
prevention.
Mm-hmm.
So I have a few products that we'll go over at the end that I really like.
And when we're talking, a few of you guys probably have our Epion's line, which is my favorite. I know a lot of us feel the same because it's all botanical based and it's great. And we do have some in stock. So if anybody's running low, the company and ourselves, they're working together so we can ship stuff out to you guys. So if anybody wants any products, even just to start, if you don't have a regimen yet and want to get on one, we have the time right now. So message me, we'll do a virtual consultation and we can get you on a regimen. But our SPF, for those of you guys that have it, I have one here. Once it gets low, if you start pumping it, nothing will come out. But if you unscrew it, you can get probably a few more days out of it. So make sure you're making your products last, even the ones that are in tubes. I tend to cut them and then I roll them and hold them tight with like a rubber band or whatever, not for it not to go dry. But we got to get a little ingenious here.
Those are a few of my favorite SPF products. Can you see that?
Yeah.
On the screen. So I have the facial sunscreen, which Ali just talked about, the Epion's, which I love. They're tinted, and then the Niove brand, that's also a facial one, the middle one right here. And then for body, I like the Elta MD. We sell this one here in our office, which is great for body because you really don't want to use your facial moisturizer on your body because then it's just not going to last. So you really want a facial, separate facial and body sunscreen. And the one on the right is, I actually found that one on Amazon, the blue one. That one's a really nice body one that
What's the name on that one?
It's MD Solar Sciences.
Okay.
It's mineral-based tinted zinc oxide, titanium dioxide, which are the two most important ingredients that you want in a physical block sunscreen. Zinc oxide, titanium dioxide.
Yeah.
And
I'm just obsessed with the Epion's one because I will put it on, and even right now, just being at home with that little tint that it has, I feel like it's enough, and I don't feel like I've been stuck at home for 5 weeks now.
And then we can also talk about at-home mask.
Mm-hmm.
Those are always fun.
Yeah, because you can just literally go in your pantry, and a lot of the stuff we have in there, you can whip up to do a mask. And I know Julia's putting some. Yep. So the hydrating mask, it has avocado, cocoa powder, and honey. Honey, as we all know, is antibacterial, anti-inflammatory, which is great for everybody. The cocoa powder works on, I can't read the thing. It's an antioxidant, and then obviously the avocado hydrates and repairs dry skin. So this is a really fun one to do. I love avocado, and if it happens to just fall in your mouth, it tastes okay.
And then we have another one can you see that?
The Natural Glow with the banana. This is one of my favorites. Half of a banana, a tablespoon of honey, and also some orange juice. Orange juice is great to clean out your pores. It helps to prevent acne. The honey, again, is anti-inflammatory, antibacterial. And then the banana has vitamin A. So we know we all need some vitamin A in your skincare. So they're fun. They're little quick things that you can just put at home. And also Pinterest has some 1,000 of these. If you don't have these specific ones in your pantry, there's so many. Another one that I was telling Julia that I love to do is on my lips. I just take honey, olive oil, and sugar, and my lips are super dry. So I just like rub it, and I try to do it like a couple times a week. And whatever is left of it, I also do it on my hands because I was blessed with my mother's hands. So sorry, Mom.
I can't wait to, that's okay. I'll laser them later today.
Yeah.
I can't wait to try the lip one. Sounds really good.
And it actually does taste good. That one tastes good.
Yeah. And speaking of washing our hands, we're going to be definitely sanitizing, washing them with soap and water a lot more frequently. So you might get problems with skin dullness and roughness due to all the friction, and your skin just might be more sensitive from washing them. So we just want to make sure that you are moisturizing and hydrating your skin with a good hand cream or body moisturizer. My favorite is, of course, the Epionce one that we sell here, the body cream, and we have the restoration hand cream. And then
go ahead.
we could also do, anything over the counter, like any of those sensitive fragrance-free brands like Cetaphil, CeraVe, the other one, Aveeno.
Yeah, even just coconut oil. I was telling you guys earlier, like when my son was small, he always had like different little rashes. I didn't know if that was psoriasis or eczema, and I found that the coconut oil just worked so much better for him, and I felt better putting it on his skin, especially since I didn't know exactly what it was. So people with excessive washing of our hands right now, if you have eczema or psoriasis, you're probably having reactions right now. So use what you normally would use. Yeah. Or the coconut oil, or Epionce also has a renewal calming cream, which has the antibacterial and anti-inflammatory properties as well. And it's all botanical based. So, you're not putting anything harsh on your skin.
Yeah.
But wash those hands. Jules, do you want to touch a little bit on, I know you worked in an ER before, and what's the proper way of using your mask and your gloves while you're out grocery shopping to avoid cross-contamination? Because I have seen people at like Publix or whatnot, they have their gloves.
I see a lot of people just putting gloves, and they're touching their mask, and they're touching their phone. So it's just like
picking up their phone. So yeah,
you really want to put your mask on with clean hands, then put your gloves on, and make sure you're not touching your mask with your gloves or your phone. And then you're going to want to take your gloves off first, then your mask, and make sure you're washing your hands before and afterwards. And
wiping everything down that they've used. Like I heard people, like their steering wheels, people are not thinking to wipe their steering wheel, so they're in and out, and then they're taking off their gloves, but then putting their hands. So there's a lot of that.
It's really important not to cross-contaminate, and just be, mindful of your social distancing and where you're touching your hands, and that kind of thing.
Okay, thanks.
So
do you want to tell me a little bit about what you think our patients like first in office treatment should be? Like, what do you think? What would be yours if you were coming to see me?
I think anti-aging in general can be a complex topic to discuss with patients. So I really think that it takes a holistic approach. So I like to try and simplify it for our patients. I like to think of skin as a pyramid. And at the base of that pyramid, you have all your prevention measures, which is all the things that we just talked about that you could be doing on a daily basis, including exercise, getting sleep, well-rounded diet, in addition to the home care, home regimens about cleansing, antioxidants, moisturizing, and sunscreen. So when we do reopen, which will be hopefully very soon, I think the beginning of May, and we miss you guys so much.
I know.
How do you get back on track with your in-office aesthetic treatments? What are one of the first treatments that you're going to want to do? What's going to be the most beneficial for you? And I think for me personally, Botox. I don't know if you can see my wrinkles. Hopefully not.
Yeah, me too, girl.
So any neuromodulator treatment such as Botox, Dysport, Xeomin, Jeuveau, I feel like is an essential part of that base pyramid because it prevents these forehead lines, crow's feet, and wrinkles from getting any deeper than they are now. And you can also get a really nice brow lift with that. Kind of opens the eyes. And the injection is quick, it's easy, it's tolerated by most people, and within 24 to 48 hours, you're going to see an overall smoother skin, and the effect should last over 3 to 4 months. So that would probably be my go-to first. What about you?
Yeah, I probably would do. I mean, I think for anybody, obviously, I'm like a huge Hydra Facial person. I love how it feels, how your skin looks. I love that anybody can do it. And it's also going to treat a lot of things that we're going to see. We're going to see more people coming with like random breakouts because obviously we're probably not eating as well. We're probably drinking more. We are not probably working out. So all those factors, or some people might be experiencing more dryness. So the Hydra Facial is great to kind of target all of that. And I think this point kind of goes back to what we were talking earlier about staying on your routine. If you stay on your routine, by the time we can see you again, your skin is not going to be like this whole like mess, like we'll be able to kind of do a few things to get you back on track. So very important. But
and I also think my second one would probably be a medical grade chemical peel to kind of just for deeper exfoliation purposes, just to kind of get all the dead skin off, to give your skin just start with a fresh, clean slate. So a good deep medical grade chemical peel. I really can't wait to do one of those.
And dermaplaning, I miss.
Yes. Well, how do you feel about those? I see those things you can buy on Instagram, the like dermaplaning at home.
I always say it doesn't hurt. It doesn't hurt to try. You're not going to get, because the tool that we use in office is completely different than what you can buy. But right now with what we're dealing with, absolutely. If you have one that you like, that's going to remove a little bit of the dead skin. Again, don't overdo it.
Yeah.
If you're one of my patients, you normally come every 4 to 5 weeks to get it done. So don't just sit at home because you're bored and over exfoliate your face. But it doesn't hurt to try. Same with like the do-yourself stuff. It's fun right now. We're in a completely different situation that we're used to. So go for it. Also, if you're a reader, there's a book I'm reading that's called Skin Side Out. It's really, really good. I'll actually link it. I meant to do it. But just for you to understand, if you have a little bit of time to read, just understand why some of us are more for natural products versus what you can buy at the store, what ingredients you should be looking for. Like this is going on your skin. You should be educated enough that you know exactly what you're putting on, even if we're not there to guide you, because it's really important.
Right now you have some time to do your research, do your homework, do your research, ask those questions. And then as I was talking about that skin pyramid, as we kind of move up the pyramid to the base, we kind of have other treatments that people are looking forward to doing, some reversal anti-aging treatments that can correct sun damage, such as light and laser treatments and fillers that can be done every 6 months to 1 year. And that will help an overall better improvement of your skin health and enhancement of your appearance. So that's also at the top.
Can't wait for all of that. I'm going to be your first patient over and over again for a week.
So,
is there anything else you wanted to touch on?
If anyone has any questions, feel free to let us know. And I was going to just post this contact info if anybody needs to contact us. Which I don't know where my screen went. Here we go.
Yeah, guys, any questions, anything you have? I know, we're just doing a quick live here, but I am completely open during the day. If you want to just message me, have a phone call, anything, I am being more than happy to guide you with some skincare.
Special guest speaker.
Woo! Who could it be?
I don't know.
Dr. Shiner, you want to say a few words for our viewers?
Well, hello, everybody. So thanks, everyone, for tuning in. And we have the lovely Allie and the lovely Julia sharing their skin tips. We're very excited. I was going to suggest, take your phone, take a picture of this. So if you want to contact us, please do. I'm going to type it in again in the chat. I'm going to put a link to, if you want to set up a visit with Tony, webinar discovery call, you can do that. Also, know that tomorrow at 1 p.m. we're giving a talk on how to reverse sun damage. And then Friday, Julia's going to be back talking about the amazing halo that we have in the office and ways that can help skin. I want to say for everyone, thank you for tuning in. I want to say, first of all, that we got to think about everyone who's helping out in in the community right now. Our first responders, want to thank them, the doctors and nurses, the staff in the hospitals, the politicians for passing the stimulus package. Thank you so much. The essential workers who are helping us survive these times. These are the people working in the supermarkets, right? The people delivering our things that we're ordering from Amazon. They're just all the truckers.
Yep.
Oh my God, I'm so thankful for all those people who are helping us survive this.
Yeah.
And you for staying home and fighting this curve. It's doing amazing things. We're not having anywhere near the deaths that we expected. The hundreds of thousands are going down to like tens of thousands. Thank you. And we're tuning into these webinars for it's fun, and we're trying to give you a break in your day and to learn something. So these are definitely historic and difficult times, but this will pass, okay? And together, working together, we'll get through this. And so for my lovely staff, thank you so much for contributing today. And for everyone else, tune in tomorrow at 1 o'clock for our next webinar on reversing sundown, which will be awesome. And then Friday, 1 o'clock again, Eastern Standard Time, we'll have the next one on Halo. So ladies, you have anything else to add?
I was going to say, if you guys, these are actually a lot of fun to do. So if you have any topics you want us to go over and give us some ideas, we'd be more than happy to do a couple more of these. So let us know.
Now, if anyone has any other questions while we're still here in the chat box, if you want to write any questions, you can. For people on Facebook, I've been answering some questions there. You can ask questions there as well. Cindy Hazelwood actually responded on Facebook.
Hey, Cindy, miss ya.
You miss her. So
I would miss everybody so much.
So if you have questions, just in the chat box, for a minute here, if anyone else wants to make any questions, we can answer them now. We'd be happy to answer questions. We'll give it a few moments here. But if not, thank you guys so much for tuning in. And we're very excited to have you join us again tomorrow for our next webinar. And everyone stay safe out there. There's a question if there are any offers for today.
Julia?
Yes.
Did you do, we did the offers for today?
We're doing the Definage giveaway, which will select our winner. But I don't know, Dr. Shiner, what do you think?
So I think that's great. And then because I think we had some ideas before there about this. Let me see if I can find this. Hold on. We were thinking.
Ask Tony. Info at.
Right. We thought for the products, for the our in-stock products, while supplies last, we can offer 20% off any of our in-office products. If they're out of stock, we can ship them to you as well.
Tony just said 20% off any aesthetics treatment. So there you go.
There we go. Excellent.
20% off. So just be sure to message us on what would be the easiest way to message us?
The best thing is for them to
Facebook?
go to this, I'm going to type it in here again, to this discovery call and set up a call. It's is a call with Tony, and she can just go over the details with you.
Awesome.
Yeah, so 20% off. That's
awesome.
Deal for today.
Yeah.
Yeah.
Well, thank you guys for joining us. This was so much fun. We miss everybody so much. I can't wait to give all my patients the biggest hugs. I'm going to keep you in my room longer than I need to.
But probably with our masks on initially. But hugging with our masks on, right? And with gloves.
Yes, of course.
Okay, bye guys.
Bye.
All right,
Thank
bye
you.
guys. Thank you.